introduce ourselves first.
Yeah, sure. Hi, Sean.
Jamie.
So this is for our discussion project about injuries and whatnot. And so the injury that I was going to ask you about that I kind of wanted some more feedback on and wanted another mind on. So I had a basketball player about a week ago come up to me after practice, and he was kind of having some hand pain. So did the evaluation, and history reveals that it was about 2 or so months ago when he was playing basketball. He fell with his arms flexed way above his head, and he fell on his right hand.
Okay.
Didn't hurt anything else, but he said his hand felt painful. So he iced it and then gave it a few days, and he said it felt a lot better, and it didn't bother him for about another month and a half. And then in practice about 2 or 3 weeks ago, he said he was very aggressively guarding someone, and when the person went for a shot, they swatted his hand really hard, and it started hurting him ever since. So he said handshakes really hurt. Other than that, sometimes with kind of radial deviation, it'll hurt a little bit. But other than that, it doesn't bother him too much. So went through evaluation. It turns out most of his pain is up closer to the fifth, so right about there. Less so kind of in that carpal bone area. So after that, he had normal strength and whatnot. It was just kind of that pain. And I shook his hand and I did pronation, supination, and there was a little bit of pain, but it didn't really go down into the carpal bones. And fluoroscoped and didn't see anything specific, so I started him on kind of a conservative wrist strengthening, icing protocol, warming up before he does any sort of lifts or anything. And so far, hasn't really responded very much to it. So before I go get more imaging done, I was curious if you had any other ideas of maybe what even it could be or another way to treat it before, and maybe in the next week or so before I decide to go get imaging.
When you checked him out, did you do check grip strength bilaterally?
I didn't.
Okay.
That's one thing.
So that might be something to look at, because if he's diminishing in strength, it could be, since his injury was so long ago, could have been an injury that's now causing muscle weakness. So that could be something you could look into. And then if that's a problem, obviously something that you could address with physical with exercise. So that could be kind of a focus, because obviously we don't want that to get too imbalanced. But you aren't concerned about a hamate fracture at all?
Just the location of it, and nothing I could do elicited pain that low. At this point, no.
Okay.
I wasn't, especially since it's been going on for so long and it wasn't getting worse. And his movement was okay, but the pain mostly was really actually far up, kind of at the base of that.
Okay. Yeah, I would say focus on grip strength if the wrist stuff doesn't seem to be doing as much as you'd like it to, and then I'd maybe focus on, as kind of strange as focusing on one finger at a time strengthening is, if you can cut a band small enough, actually doing resisted finger motions and some... Do you guys have one of those nets?
Yeah, those spiderweb nets.
Yeah. Something like that. Those things could help if he might have just developed tendonitis or something.
Yeah.
So those would probably be my suggestions. But if it doesn't get better, I'd just refer him for a possible fracture of some kind that wasn't caught before. So. Yeah,
I'm praying it's just something simple. And
something silly, yeah.
It's going to turn into a pain, because the last thing I want. He's our shooter. He's our 3-point shooter. So.
Oh yeah, that could be a problem.
Last thing that we want is.
Right.
Yeah.
A hand injury. Okay.
No, I didn't think about doing that. I think that's real. I think we have a grip strength checker in our basement.
Okay.
In the lab, so I might be able to try and grab that and see if we can use that, measure that. And then I didn't think about doing kind of individual resistance exercise. I've been doing it more like putty squeezes and kind of deviation and then handshakes. So that's a good idea. I really like that.
Okay.
I'll give that a shot.
Yeah, I would start doing that just a couple more weeks, and hopefully it'll resolve itself.
Let's hope.
Yeah, I know. Okay, so we'll move on to mine. This was a previous athlete I had on my high school cross country and track team. Now, she presented to me during track season. She was hardly able to get through she did the mile and the 2-mile race. This was right after a mile race, probably 3-4 weeks into season, and she wasn't able to finish. So she didn't come to me specifically. I went to her, and she told me that she had been having heel pain. It was not on the Achilles tendon. It was anterior to that. very specific locations, so she could take a finger and say, this is the spot that hurts. She had gone to physical therapy before, I think the previous year, and it was never resolved. Nothing helped. She struggles through cross-country season. She has to cross-train for the majority of the week, and then she just races. And so I started her on a home exercise program, but it was the same general, balancing, strengthening that she had probably previously had.
Yeah.
So I was just kind of curious what your thoughts on, because I wasn't sure what it was, and what your thoughts on a possible pathology or a different approach to heel pain.
So
possibly.
It was lower on the Achilles, closer to the calcaneus?
Yes.
Or, okay.
Yeah.
So did you rule out like tendinopathy, or were you thinking it was that, or was it?
I didn't jump to that just
Okay.
because her pinpoint pain was on a bony spot.
Okay.
She didn't have any lack of range of motion, and the only time it hurt was running. So,
Okay.
Yeah.
Do you know if she was one that wore heels a lot? Maybe the bursa was inflamed, or
I do not know what
Okay.
her daily routine for that was. That's a good point.
I know one of the volleyball players that I worked with in the past, she was one that would dress to the nines every single day, and she
Okay.
wore heels a lot. And you get that apophysitis there.
Mm-hmm.
But in her, she didn't have the apophysitis. She actually had the bursa that got really inflamed, and we actually had to aspirate the bursa.
Oh, wow. Okay.
So, but we could also palpate that, which you might have picked up on the palpation. So that's
Right, and I think I
interesting.
was thinking for the fact that it had been such a long time, I wasn't thinking.
Did she ever get imaging?
I don't think she did, not
Okay.
that I was aware of. So,
I doubt there'd be a slight avulsion, just because of her age, and it sounds like she runs a lot, but it doesn't sound like she has a very overly intense for her age.
no, not at all.
Maybe a stress fracture, but that is an interesting. I think at that point, and it's hard because at a high school that you can't exactly tell them go get imaging and then know that it's going to get followed up if it's not like an emergency issue. It's based on the parents' discretion.
Right.
But what were you trying for rehab? Like what you said you had done?
Yeah, so I had open chain resisted four-way motions. I was doing balance. I think I had her on an AirX pad for that, and then some closed chain hip kicks for some just whole kinetic chain strengthening. What are your thoughts on that?
I think that those were things that I would do too. Maybe, and I guess you probably didn't have a lot of modalities available to you.
Yeah.
I mean, eccentric. Did you do any eccentric exercises or?
I actually throughout the season, I don't think I had her on any of that.
I think that could have potentially helped just a little bit. I know we actually talked about it today.
Yeah, a little bit.
The use of eccentric exercises. Those are one that I'm a big fan of. And
Okay.
I really focus on, it might be a little bit harder for dorsiflexion and plantar flexion, but if I was going to do eccentrics with the bicep, I really focus on making them aware of their break points and working through those break points. So saying we're going to go down, okay, you feel that where you just broke and you gave up, don't do that. We're going to go all the way down. I want you to resist. And it might be a little bit, I've never actually tried that method with plantar flexion, dorsiflexion, but I could guess that there would be break points. They might not be as noticeable as maybe with the bicep, but that's one thing that I found. And once you could work through those break points, and they can go through the full range of motion with the eccentric, concentric, that really helped. At least with bicep tendonitis that I found. It would be interesting if we could put laser on this person just to see if there would be
I didn't even think about that. Yeah.
But obviously, in a high school situation.
Yeah, I probably would have had her. If she would have come to me first, I would have had her at my physical therapy clinic. So, but since she'd already done it and it had failed, she wasn't really up to that challenge. But had I thought about laser, if she hadn't tried that before, we did have that at the clinic, so that might have been something to offer. That's a good point. Yeah.
Did you ever find out what happened with her? Or what
No, I have no idea. So yeah, track season was over and away they went.
Little brain beater.
Yeah. Yeah, I'm not sure about that one. I felt bad for her, but.
Well, thank you for your advice.
Yeah,
I really
absolutely.
It.
I think that was good.
It was
We
good
got a
too.
plan.
Oh, that was 9.